My name is Alexander Odette, and I'm a registered practitioner of traditional Chinese medicine and acupuncture, and I've been practicing orthomolecular medicine for the last 18 of the 20 years that I've been in practice. I was introduced to orthomolecular medicine by Dr. Richard Johnson, whose office was next door to mine. Although I remember my true introduction to vitamins and nutrients was when my father, who was a pilot, began taking orthomolecular doses of nutrients after having read Linus Pauling's book Vitamin C and the Common Cold back in the 1980s. My background before Chinese medicine was in chemical engineering, so I can make some claim to chemical literacy. And what struck me as important about orthomolecular medicine was that it used principles of dynamic equilibrium, also known as Le Chatelier's principle, to right the wrongs in the body by allowing us to shift the equilibrium to the direction that we would like to favor by altering concentration of nutrients. One of the most memorable results for me in orthomolecular medicine was when I received my first Myers IV push when I was coming down with a cold. It pretty much stopped it on the spot. Similar results can be achieved with acupuncture and Chinese herbs, but I remember thinking that combining Chinese medicine with orthomolecular medicine would probably be even better, which is what I began doing. In Chinese medicine, we don't have access to blood tests and the high-tech tests to help us with our diagnosis. However, the same results can be achieved with symptomatology and careful medical history taking. Although Chinese medicine has a unique pre-scientific terminology, with a little thought, that terminology can be adapted to fit with orthomolecular principles. An example would be niacin. Niacin in orthomolecular medicine has many functions. It's an antipsychotic, which would be thought of as nourishing the heart and calming the spirit in Chinese medicine. It lowers cholesterol, which we would say dries dampness. It's a precursor to glucose tolerance factor, aka a qi regulator. It induces a flush, which is like releasing the exterior, and it has antidiarrheal functions during cholera, which is the same as stabilizing and binding the intestines. The analogy that I like to use when it comes to combining different modalities of medicine is to think of medicine as a big swimming pool. Although we all swim in different sections of the pool, nothing should prevent us from trying out new strokes and swimming with others. When I met Dr. Abram Hoffer in 2007, I asked him why more physicians didn't practice orthomolecular medicine, and he said, because they're afraid of it. What we should all take away from this is that we should all just dive in and swim, as fear is the worst disease we have yet to conquer.